More light has been shed today on the human cost of the coronavirus pandemic across the United Kingdom. The latest official figures, for the first time, include all deaths linked to the virus, including those in care homes and other community settings. And they show that the pandemic has so far claimed nearly 4,000 more lives than were being recorded under the previous system. Now, the latest figure over a 24-hour period is 765 deaths across the UK. It means that the total number of deaths so far in the UK of those who tested positive for coronavirus is now 26,097. Our health editor, Hugh, has been studying these new figures and explains the implications.
Happier times for Betty, celebrating her 97th birthday. She's now in critical care in hospital with coronavirus. Her daughter Andrea says she picked up the virus in a nursing home, and testing at an earlier stage for residents and staff might have kept her safe.
I think it's a bit late. I think that coronavirus, if the truth be known, is endemic in our nursing homes, and the people that are going to suffer the most are the elderly and the vulnerable, not to mention the staff.
Testing for all care home residents and staff, including those without symptoms, has now been made available, either with kits sent to the homes or mobile units visiting them. Managers say they need help running the testing, and it's urgently needed.
I do think that there is a tsunami of deaths that we may have been able to avoid should we have had this testing an awful lot earlier. Because the elderly do not, they don't present in the classic way. They don't normally have rip-roaring temperatures. It can be quite insidious. They're just a bit off colour.
I asked about the new care home testing plan at the Downing Street media briefing. Couldn't testing really have started sooner than now?
The scale and the speed of this epidemic is really in the last couple of weeks, and there is a huge national and local endeavour to both not just test, which is very important, but to also understand the measures that would make a difference in care homes, and to look at that in a very rapid way, looking at the evidence, so that we can put in place measures that protect people.
Drive-through testing or home kits have been made available to millions of others with symptoms, including Heather, who did her swab test at Taunton today.
Because I'm a private carer, I work for myself, so I couldn't get tested before today. And it is really important, not for me, but also for my clients.
Over 65s qualify for testing as well, like Mac and Anthea.
Well, we both had the symptoms for a few days. And so therefore we really wanted to get checked, but the symptoms hadn't increased, so we didn't need to phone the 111. But as soon as the test for over 65s, which we are, came available, we were quite happy to come and have the test.
Home test kits can be ordered online, but only by those with symptoms. We haven't opened the packaging of this one, so it is safe for future use. There are a couple of different types of home testing kit. This is one of them. Before you do anything, you need to register online and book the free courier collection service to come and pick it up. Then you take the swab sample from your nose and throat, put it in the plastic container and then the packaging, and it's ready to be collected. Slots for drive-through tests have been in high demand. Home test kits ran out earlier today, but with new supplies are bookable again this evening. The Health Secretary Matt Hancock has set a target of 100,000 tests a day by the end of this month, and that's tomorrow. Hugh, BBC News.
Well, in Scotland, more than half of deaths linked to coronavirus are now happening in care homes, according to the latest figures from the National Records of Scotland. Our correspondent Lorna is in Glasgow with the latest details for us.
Yes, Hugh, these figures show that the number of people dying from confirmed or suspected coronavirus in care homes has overtaken the number of people dying in hospitals here in Scotland for the first time. Since the outbreak began, just over a third of all COVID-related deaths in Scotland have been in care homes. But week on weeks, the number of deaths in care homes has continued to rise. And that means that the figures show that in the 7 days up to Sunday, more than half of all those who've been dying from confirmed or suspected coronavirus were care home residents. That equates to one COVID-related death in a care home every 30 minutes. Well, Scotland's First Minister Nicola Sturgeon said the proportion of deaths was deeply distressing. She said it was broadly in line with what's being reported in other countries. She also today outlined the measures that's being taken to help care homes. Opposition parties here, though, are calling for the Scottish Government to go further with its support for homes. But I think what these figures show, along with the news that another set of care homes, the Erskine Care Homes for ex-servicemen and women, reported that they've lost 24 of their residents to suspected coronavirus. This confirms that if the virus does take hold in a care home, it can be devastating.
Lorna, many thanks again. Lorna Gordon there for us in Glasgow. With me in the studio is our social affairs correspondent, Alison Holt. And for weeks, Alison, you've been talking about the situation and the threat of the kind of crisis we're seeing now in care homes. So if I was to ask you for the main factors which have led to this crisis, what would they be?
Well, it's first off important to remember that we are talking about care homes looking after some of the most vulnerable, older and disabled people in society. And across Europe, there have been issues over a high number of deaths in care homes. But in England in particular, this is a system that has been under pressure, underfunded and in crisis for a long time now. It's also fragmented. More than 15,000 care homes. Some are privately owned, some not-for-profits, a few run by local authorities. More than 400,000 residents. About half pay for their own care, about half are publicly funded. So it is complicated. And when I look back at my reports, right at the beginning of all of this, we had care providers saying our PPE, our protective equipment's being diverted to the NHS. We need more testing of staff and residents, and their voices have become increasingly desperate as the weeks have gone on. Unlike the NHS, there is no single powerful voice for social care. No one arguing their case, no one shaping a national response to a national crisis. And whilst the increase in testing that's coming now is welcome, there are many care providers who say it's simply too late. And in time, there will be some really important questions we need to ask about what needs to be done differently, how we integrate social care into a wider health and care system, and properly recognise what they do.
Alison, many thanks again. Alison Holt there for us, our social affairs correspondent.